Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 103,918 confirmed cases of COVID-19 in Canada and 34,911 cases in Ontario. Chatham-Kent has 158 cases, and Sarnia-Lambton has reported 285 cases. Michigan now has 63,497 cases, with 11,543 cases being in Detroit. Today, we are reporting 1,602 cases of COVID-19 in our community, an increase of 22 cases from yesterday. 6 people work in the agri-farm sector, 4 are healthcare workers. 869 cases have now resolved. 611 people are self-isolating. 25% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39 years. 62% are male, and 37% are female. 1% is unknown at this time. Our community has lost a total of 68 people to COVID-19. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care homes currently experiencing a COVID-19 outbreak, and there are 6 workplaces in the agriculture sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can be mild to severe. Some common symptoms include a fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, or if you're feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alet Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at reachu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates on COVID-19.
Good morning, everyone. Thanks again for joining us at the start of your day. There have been many changes in a very short time for Windsor-Essex, with the announcement last week of movement to Stage 2 and the additional protection measures put in place for wearing face coverings in commercial establishments. We have been receiving a flood of questions related to the face coverings order, and so I thought I'd provide some clarification on these questions this morning. The current order under Section 22 of the Health Promotion and Protection Act, which can be found on our website under Guidance and Restrictions. It requires all commercial establishments in Windsor-Essex to create and implement a policy that prohibits a person from entering the facility without a face covering. Commercial establishments are businesses generally open to the public, such as retail stores, grocery stores, restaurants, gas stations, convenience stores, etc. The order does not apply to office buildings or other settings not considered a commercial establishment, although these workplaces may develop and enforce similar policies for their employees and visitors if they wish. Commercial settings covered under the order must determine in their policy how they will enforce their requirement. Provision of mask free or for sale, or for individuals who may come to the establishment without a mask. Signage and education, and dealing with those who the order may not apply, such as young children and individuals with medical accommodations. Face coverings are required for employees working in restaurants and patios, but not required for the patrons while seated outdoors at table, physically distance from each other. We have heard reports from people being asked for doctor's notes to provide they cannot wear a face covering. This is not the intent of the order. We have also received complaints regarding businesses not adhering to the order and not requesting patrons to wear a face covering. To ask a question or make a complaint, residents can call the health unit at 519-258-2146 extension 3100 or call your local bylaw or for Windsor 311. The health unit's enforcement officers are out every day and will follow up on complaints related to all orders, monitor compliance, and provide education to businesses about their obligation under the order. The health unit will always use a progressive enforcement approach with education as the first step. However, non-compliance on the part of business could result in fine being issued under the Section 22 order. Tomorrow, as we celebrate Canada Day, I wish to remind everyone to continue to be mindful of the public health measures and requirements and continue the great work we have been doing to protect our communities and ourselves. Any celebration should be kept to no more than 10 persons. Please keep physical distancing at all times unless the gatherings are all members of your social circle. To stay healthy and safe on this Canada Day, wash your hands frequently and often with soap and water or alcohol-based hand sanitizer. Maintain physical distancing where possible and wear a face covering when physical distancing cannot be maintained. Keep good respiratory etiquette by covering your cough and sneeze. Drink responsibly, follow the low-risk guidelines, and do not drink and drive. If spending time outdoors, keep hydrated and cool by drinking water regularly and often and staying in the shade if possible. I wish everyone a happy, safe, and restful Canada Day. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Yeah, just regarding the mask policy, I know it's not required for people going into stores to provide a doctor's note, but what about employees? If workplaces are creating policies, is it under their purview that they could request a doctor's note if there was some kind of medical condition that prevented them from wearing a mask?
So under the order, we have not put any conditions to provide a doctor's note for the mask. The employers can make that distinction on their own. It's not a requirement under the order.
Okay, and so there's 22 cases, 6 are agri-farm, 4 are healthcare workers. So that means 12 is unknown, or are they community spread?
At this point, I would say they're unknown because of the high volume of the cases. Our team is rapidly catching up on all these cases, and right now I can't say if whether they are called close contacts or community.
Any questions from AM 800?
Dr. Ahmed, just looking for some clarification in regards to yesterday's numbers. So yesterday, the local health unit reported 88 new cases, but the province reported 177 cases. What's the difference there?
So I think there are some numbers, obviously some calculation that happens with the way we are counting. So I can't really speak what they are or how they are counting. And what I can tell you is we always get the positive results, anyone who's in our community. And I would say that our numbers would be more accurate, and if there's any discrepancy, our epidemiologists will definitely get in touch with the province to update those numbers as soon as possible, I would say.
Okay, and when it comes to the face coverings, you mentioned there has been some calls. I'm not sure if I missed this, but has there been any warnings or fines issued as of today?
I think we have attended to complaints to some of these establishments who are not following or implementing the mask policy. So those businesses were attended, and we received some complaints, and we hope that with the progressive education, all businesses and commercial establishment will enact policies and procedures to ensure that people entering their facility have a face covering, or a policy that how they will implement face covering. The intent is again not to go to the extent of asking any medical exemption or any certificate with that, but at least they need to have policies and procedures in place to ensure that they're implementing it and denying entry to people who do not have a face covering.
Thank you. Just sorry, one more. Is there a daily briefing tomorrow morning?
No.
Okay, thank you.
Any questions from Windsor?
Do you know how many businesses are not adhering to the mask policy requirements?
We can only say the complaints that we have received, and so far we have received, I want to say at least 2-3 complaints, but again, number of complaints doesn't necessarily mean that how many are not complying. We just followed up on at least 2 or 3 complaints that we have received.
And in another area of Ontario,
Masks are required at businesses. There were a few businesses that displayed sort of, I guess, an egregious disregard for the policy. Have we seen anything like that, or has there been pretty good compliance?
So far, it's good, and I would just commend the community as well that most of the people are following that. And just like in many other things, Windsor-Essex has been proactive in implementing this mask policy. But what we are looking at provincially now, there's been this uptake, and other jurisdictions are also implementing that policy. So I think as an overall province and community, there will be more and more of these requirements, which would help everyone to and encourage everyone to wear a face covering in these commercial establishments.
Okay, thank you.
Any questions from the Windsor Star?
Yes, I just want to ask, you reported today only 6 migrant workers testing positive. What do you attribute that to? It's a pretty big drop in the numbers that we've seen in the last few days. Is it because fewer test results are coming back and because you caught up, or what do you attribute the big drop to?
So there are a lot of asymptomatic surveillance targeted testing happening, and there's been some updates in terms of how that's scheduled. All I can say about the 22 one is the drop in number of testing. So we can't really say that we tested 500 or 600 people, and out of these, there's just 22 people are positive. It's most of these testings are still targeted, and we may see these numbers go up and down, and yeah.
Do you have any strategies that you're putting in place today to get more people tested in the Leamington-Kingsville area?
Well, the asymptomatic testing strategy is led by Ontario Health, and they are leading that strategy, so I would direct that question to them. From our public health case and contact management perspective, our team has been actively engaged with all the farms that currently have cases, and we are encouraging and getting more and more tests done based on our investigation and our case follow-ups.
Okay, thanks very much.
Any questions from CBC?
Yes, good morning. Are gyms allowed to open in the region under any circumstances?
So the only way that they can open or they can allow their members is if the facility is outside, if it's less than 10 people who are exercising without sharing any of the equipment then. But otherwise, generally speaking, in stage 2, there is no provision to allow gym to be open.
So in stage 2, there's no provisions to allow them to be open, but they can as long as safety measures are being followed and they're outside, basically? Is that what you're saying?
No, and I didn't say that. What I'm saying is there may be some small groups which could be organized at either people meeting together in less than 10 number, and they're exercising. So you can't really tell that if it's a business or if it's just people just coming together and doing the exercise. The only thing that's still it's any kind of organizational, if that is happening, is not following or under the same umbrella of a gym or sharing any of these equipments, because what we are trying to prevent is still the spread of COVID-19. Any kind of equipment that's being shared is under the violation of the Emergency Management and Civil Protection Act, and increases the risk of spreading COVID-19 among people. The other thing is still we are under the Emergency Management and Civil Protection Act, which restricts people gathering of more than 10. So anyone who is gathering in more than 10 number would be in violation of Emergency Management and Civil Protection Act. Any gym services, if they're providing any equipment or if they have any equipment that is being shared, that is also not allowed under the Emergency Management and Civil Protection Act.
And what would be the implications if a gym was breaking those protocols?
So again, that would be something that our inspectors and our tobacco, vaping, and enforcement officers will be enforcing in collaboration with the municipal bylaws. But under the Emergency Management and Civil Protection Act, some of these guidelines are very clear, very specific, with what is allowed in stage 2 versus what is not allowed in stage 2. So I think some of those distinctions are very clear cut. There are some gray areas that maybe that require more interpretation, but as far as the gym and the sharing of equipment and gathering of more than 10, that's very clearly laid out in the Emergency Management and Civil Protection Act.
And yesterday we, obviously a lot of farm workers or workers in the agri-farm sector who had tested positive. How did the assessment of those workers who tested positive go yesterday? Will any of them return to work?
Well, under my direction, none of them were allowed to return to work. We spent a lot of time in reviewing all the case details, everything that we collected. Yesterday, we have had a number of consultation with various groups. We are looking at that information, but all I can tell you is all the positives, they are not allowed to return to work after the health assessment.
Thank you.
Any questions from CTV?
Yes, good morning. I wanted to ask about Premier Ford's comments yesterday concerning the agri-farm sector. He had mentioned that there were 70-some orders that had been issued to farms and greenhouses in the region. And I believe yesterday you had said no fines had been levied against any of the operators in the agri-farm sector. Are those two things different, or can you explain to me why an order might have been laid but not a fine? What's going on there?
So I think I cannot speak entirely to what Premier Ford was mentioning. So an order, like I have issued a Section 22 order, a class action order to all the farms. So that's one thing that we expect under the Health Promotion and Protection Act, under the authority of the Medical Officer of Health, for all these farm owners, operators to take certain action to prevent and reduce the spread of COVID-19. And then there is other oversight of these farms under OMAFRA, under Ministry of Labor. They have their own policies, their own law that they use to govern these all these workplaces. There could be order, there could be fines that could be that was issued to them. I'm not aware of that, but all I can say is from our region, under the authority of the Medical Officer of Health, I have not issued any fines to date. But I have issued Section 22 orders across the board for all the agri-farm sector to take appropriate action to prevent and limit the spread of COVID-19.
And to pivot to the patio situation again, one of the questions that has come up is how these bars and restaurants are complying when they're going out and they're setting up these gazebos that essentially create an enclosed space while being outside. Is that a gray area in the stage 2 regulations? Is that something that puts them in compliance, or would that be something that the health unit would not want to see?
So the health unit has put out some specific guidelines with respect to how these businesses, patios, and outdoor restaurants can operate under the limitation of the Emergency Management and Civil Protection Act. So all of those guidelines are put together in our toolkit that is available to all the businesses, and we have attended some complaints and concerns, but not necessarily in terms of how they are set up, but mostly in terms of what is being allowed. So, for example, any singing and dancing is not allowed in any of these establishments. So if there's any concerns about that, we will be addressing to that. But people congregating close to each other, not maintaining physical distancing from their own outside of their family or the group that they come to that came to the restaurant. So all of those things are being implemented, but overall all these policies and guidelines are put together by our health unit and is available to all the businesses.
And so, as you say, you have received quite a few questions about the mask policy, but not a lot of complaints. Is that correct?
Well, I think a bit of both. So we have received at least 2-3 complaints, and I was just referring to that. That doesn't mean that the concerns are just with these 2-3 businesses. It only depends on who is complaining to us, and our team is following up with all those business establishments to use the progressive education and enforcement approach. And continued violation and continued disregard of the order will result in issuing a fine from the health unit.
In terms of what the health unit has seen, have you seen general compliance among these the bars and restaurants that were quick to open up once we reached stage 2?
Yeah, mostly they're all compliant and they're all following all these guidelines because they want their businesses to continue. They want to stay in stage 2, and I would just encourage them to keep doing that so we can continue to do well with limiting the community spread as well as not causing any undue hardship in social and economic disruption.
And just last question, is the testing at the farms, is that being carried out, for the next coming weeks? Like, is that going to be a recurring thing where, we've had a batch of workers tested, but will they be retested?
So all I can say again is the asymptomatic surveillance testing initiative is being led by Ontario Health. They have a strategy that they are using to test these farm workers. At this point, I'm not aware of any recurring testing strategy, and that's a question maybe Ontario Health can answer. But at this point, I'm not aware that if there's any thought or consideration about recurring testing strategy.
Okay, thank you.
Any further questions from Blackburn?
Yeah, the city of Windsor just put out a release about Huron Lodge, one of their staff members that tested positive, but I'm not seeing that on an outbreak on your website. Is that just a misprint? Are there 3 now under outbreak, 3 facilities under outbreak then?
So there are a number of activities that are happening with the long-term care homes and retirement home, and there is an ongoing requirement for the staff to be tested at least twice in the month of June. So that testing has happened, and as a result of this testing under the directive number 3 from the Chief Medical Officer of Health for the province of Ontario, if we get one asymptomatic staff member positive, then the question becomes whether this is an indication of an outbreak or a declaration of an outbreak. And most of the time that declaration and assessment happens after a thorough review of the cases. So all I can say is yes, they have a positive case, but that doesn't mean that they do not fall under the definition of an outbreak at this point. So that's why you're not seeing that on our website.
Okay, so that's changed then from what it used to be?
This because of the asymptomatic testing and the surveillance testing initiative. So under the new directive number 3, that's what it means, that if you have one asymptomatic person and while working, if they are using all the appropriate personal protective equipment and everything else is maintained, the consideration for an outbreak is not the same as it used to be in the beginning when you have one case and then the declaration of an outbreak happens.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, just one here. I'm just looking for when it comes to the agri-food sector. We've been focusing on Leamington and Kingsville, but obviously there's Bondwell and Tecumseh. Their living conditions are different, I believe. They live in, have it written down here, almost like group housing, not bunk housing. So what's the difference there? Are you keeping a close eye on, I know you don't like naming the companies, but are you keeping a close eye on facilities like Bondwell as well with their living conditions?
Well, we inspect all the living accommodations for all these workers who are coming into this country under the Temporary Foreign Workers Program, so our perspective and our focus in reviewing all these accommodation is to ensure that public health safety is maintained for those individuals. Specifically speaking about this spread and limiting COVID-19 spread in the community or even at the workplace, that's the direction that we provide to the employers, to have policies and procedures in place under the Ministry of Labor, under public health direction, to ensure that they have all these policies to prevent and limit the spread of the disease. So anyone who's coming new to the country under Temporary Foreign Worker Program, they have to do 14 days quarantine period. There's no exception to that. Everyone needs to do that. And after they finish their 14 days, basically they become part of the community, and then everything that we do in the community from a spread perspective or limiting the spread perspective, they fall under that category. And at the workplace as well, every workplace need to have policies and procedures in place to allow physical distancing, to have policies to limit and spread limiting the spread of COVID-19, allow the policy to not let employee work if they are sick or if they have any symptoms. They should have a screening process in place, that everyone who's coming to the workplace, that they are doing their self-screening or an active screening or passive screening to ensure that they do not have any symptoms of COVID-19. Anyone who develops any symptoms under the Health Promotion and Protection Act, they need to be reported to the health unit to get an assessment done, get a testing done, to rule out COVID-19.
Do we know how many workers, agri-food workers, work at facilities like Bondwell? Is it obviously a smaller number compared to Leamington and Kingsville?
Yeah, I don't have that number in hand, but yeah, the bulk of these temporary foreign workers are in Leamington and Kingsville.
Okay, thank you. Happy Canada Day.
Thank you. You too.
Any further questions from Windsor?
Yesterday, the health unit said there were between 3,000 and 5,000 persons for daily case and contact management in the agricultural sector that the health unit was in touch with. In total, how many people,
including outside of the agricultural sector, is the health unit contacting on a daily basis?
So anyone who's positive, they are being followed up, and anyone, so everyone who's coming back positive, they are followed by the health unit staff for the full 14 days. And then on top of that, all the contacts of these cases, we try to get in touch with them every day or every other day, because those are identified as contacts and may not necessarily have the disease. But those conversations happen, and then when it starts to accumulate over the time, you can imagine that if we have 10 today, then 10 tomorrow, and then the day after, even though it may sound 30, but just the number of daily calls will multiply by the number of contacts. On an average in the community, we would expect 4 to 5 contacts. What we are seeing in the agri-farm sector, we are experiencing at least between 10 and 12 contacts per positive case. So those are the follow-up that's happening regularly by our health unit. All the positives are being followed up every day by the health unit.
Do you have a number for approximately how many people the health unit is following up with? More than 5,000 or so?
I don't have that number on hand right now, but as you can see from our data, there are at least I would say close to 400 or 450 people or more that are currently in self-isolation. So all of them are getting a call pretty much every day, and then on top of that, all their contacts are getting called, if not every day, then every other day, or on a regular basis.
Okay, thanks.
Any further questions from the Windsor Star?
No, I'm good, thanks. I'm all set.
Any further questions from CBC?
Yes.
Dr. Ahmed, the pandemic started in mid-March, and it's been about 4 months now, and other health units around this province especially are starting to see slower rates and winding down. And I'm wondering if you and Teresa are going to get a break tomorrow and how you're handling everything so far.
That's the dream that we are both looking at it, and all I can say is when I put my phone down, I was talking to Teresa. It was almost close to midnight. So that's our life for the last 3 months, and I think in the coming weeks, that's what we're looking forward. So, but thank you for asking. It's been a challenge not only for us but also for our health unit staff, and I can attest to that all of them are working really hard to keep our communities safe, and we'll continue to do that as long as we have COVID-19 in our community.
And as you keep working on this, I mean, you've faced the health unit has faced a lot of backlash. What's it been like being in the middle of this?
Well, I think we try to focus our energy in managing the pandemic and trying to keep our communities safe. Decisions and actions that happens in these type of large mass incidents, there are always people who may have an opinion, who may disagree to it, but all I can say is your health unit is properly qualified. We have all the expertise, and the people who work in public health, they understand, they recognize the value and the work that we have been doing. And we have heard that from everyone who's engaged and involved in public health. We have heard it from our board. We have heard it from the Minister of Health. We have heard it from the Premier. We have heard it from from all levels of Ministry of Health, appreciating and understanding the work we are doing. So that's a satisfaction on our end. But we like to focus again on doing our job despite everything that's happening, and try to ignore and focus on the safety and well-being of our community. This is our community. This is where I live in. This is where my children are growing up. This is all of us. So I think all of us have an obligation to do the right thing, and we will continue to do the right thing.
Thank you so much.
Any further questions from CTV?
Yes, just one for Dr. Ahmed. There's a social or an activist group for the agri-farm workers that has called on the sector to shut down for 2 weeks because of the outbreaks the sector is seeing. Is that anything at any time you had recommended or considered in your backroom talks and thinking about how to handle this situation?
So good question, Ricardo, and maybe we'll just put some limit to how many questions you can ask every day. Going back to the pandemic response, I think it is very important to keep our focus and keep our objectives very clear. So from a public health side, our objectives are very clear. The response for pandemic is to save lives, is to ensure that anyone who is infected, they are getting the care that they need, and then limiting and reducing the spread of transmission in the community. So those are the public health goals. The overarching goal also is to protect our healthcare system, protect our economic and societal impacts and disruption in the community. So having said that, everything that we are looking at this sector right now, understandably, there are many more cases that we are seeing compared to the rest of the community or any other sectors. Understandable. But then we have also seen some variation in terms of how many cases we are seeing in each of these farms. So you have a farm which was tested entirely with no positive. And then you have a farm that was tested but had a high number of positives. And then you have a farm that is somewhere in the middle with maybe 5% positive or even less than 5% positive in some cases. So it really makes it very difficult to paint the entire industry and every farm with the same paintbrush. So calling it a complete stoppage of work in these agri-farm sector, I'm not sure if it can be a sustainable or it would be a viable and even a decision that would make public health sense. So I think obviously from a prevention and limiting the spread perspective, we need to find that right balance that all the employers, they have a role to play. They need to have all these policies in place to early identify any case in their farm. Anyone who is infected, immediately isolate, test, and then expand the testing to ensure that anyone who needs more testing, that is happening. So I think that is the critical piece. Because if we are not doing that, we are spreading it to others, and then we are potentially exposing all of your workers at risk, and it could result in going in the direction to leading to the suspension of your entire operation. So I think we need to find that right balance. At this point, I'm not sure that if anyone is thinking about shutting down the entire industry per se, but consideration are given to how best we can work with the industry, how good control measures we can put in place to contain it, to limit the spread, and keep everyone safe, including the employees who are working these farms.
Okay, and one more question. No, I'm just kidding. Thanks, Dr. Ahmed.
Okay, thank you.
Thank you. Happy Canada Day, everyone. We'll
Yeah.
see everyone Thursday at 9:30.